Welcome to the #1 show and the source of truth for all things MedTech. Here, we reveal the secrets and stories behind the investments, science, and commercialization of the MedTech industry. Every week, we'll take you on a wild ride with the biggest names in the game, from entrepreneurs and investors who are shaking up the market to healthcare providers who are revolutionizing the way we think and practice medicine. So hold on tight and get ready for a journey like no other. This is the State of MedTech. What's going on, everybody? Welcome back to the show, and another great guest, good friend of mine, and that's Dr. Ira Kirschenbaum. He needs very little introduction. You all know him as the godfather of Ortho. I know him as Ira. But Dr. Kirschenbaum and I had spoken, recently about the importance of being a digital author, digital publisher, a digital opinion leader. Because let's face it, the old traditional way of being a thought leader as a physician is still is very much true. I think it's important to go up on podium and publish papers, but there's more to it these days, and more importantly, there's better and more effective avenues to do that. One of those, in my humble opinion, is the Journal of Orthopedic Experience and Innovation, otherwise known as JOIE. You can go check them out at joie.pub. That's JOEI.pub. And essentially what JOIE is a real-time, open access, free, and probably the first one, free medical publication where they allow orthopedic surgeons from around the world to submit and publish in real time the things that they're learning from the procedures they're doing, the techniques that they're pioneering. Because let's face it, aside from the fact that the big publishers rip us all off, they steal a lot of money from authors. I don't want to get into that. But the other side of it is that by the time something's been, peer-reviewed, published, etc., so on and so forth, a lot of it has changed. And so JOIE has a phenomenal board of peers who reviews papers. They work very fast, and they publish things that are open access so everybody can read them, but more importantly, that stay up to date. And it's probably the fastest, most up-to-date way to keep in touch with what is the latest in ortho. Dr. Kirschenbaum has this fantastic weekly journal club on Wednesdays. Joe can call it FOMO, fear of missing ortho, which I love attending. There's always hundreds of orthopedic surgeons who join that Zoom call to discuss procedures and new products. If you're an orthopedic company, I'll tell you what, if there's one thing I recommend is carve out some budget and go sponsor one of these events or one of the publications on JOIE, because it's going to be, in my opinion, a much better use of money than sponsoring some random thing at a conference. So anyway, Dr. Kirschenbaum came on the show to talk about what does it mean to be a digital opinion today, and then how do you move into this realm of publishing digitally and in real time, not just through JOIE, but also through LinkedIn, and how do you develop thought leadership amongst your peers. So it's a great episode, and of course we have a lot of fun. Now, I do have a couple of wonderful things for the clinical audience listening. Of course, this is a episode where you can unlock a free AMA PRA Category 1 CME credit. You just got to listen. Check the show notes below, click the link, and type down what you learned and what you will do, and you get a free CME credit. Now, that's not all. If you're an orthopedic surgeon and you've been wondering, like, hey, I'm established, but I want to develop more of a brand. I want to do some thought leadership. How do I even use LinkedIn? Well, I put together a very simple course that you can sit down over an afternoon and get through. That'll help you set up your LinkedIn profile, decide on messaging, and also I include things such as persuasion and psychology, so you know how to mold the market, create content and put it out there, and so that way you develop a valuable asset, which is your LinkedIn profile, which, by the way, because LinkedIn is owned by Microsoft, even when your patients Google you, your LinkedIn profile sometimes will outrank your own faculty page or your own website because of how important it is. So you can check that out. Either go to orthodigitalopinionleader.com and make sure you put www, or check the show notes below. This course is only $297, and so for a short afternoon you can become a digital opinion leader using that course. And then lastly, if you're a physician and you're sick and tired of dealing with prior authorizations, you're sick and tired of insurance companies taking more and more of that hard-earned money that you have, well, guess what? you don't have to play by those rules anymore. There's a physician named Dr. Daniel Pollard, who is an orthopedic surgeon, and get this, he runs a cash-only, insurance-free medical practice that's mobile. And, Dr. Paul's story in short was he was, getting out of fellowship and looked at his options, didn't like them, decided to flip the business model of medicine on its head and do his own thing. Now, over the years, he's gotten so many messages from people about how does he do it? How does he run a practice like this? Who do you hire? So on and so forth. And so he decided that the best way to scale his knowledge and help more people was essentially to create a course and, do it that way. Because even though he set up some consulting hours, it's just not enough time in the day for him to help everybody. So we teamed up together, and I'm very happy to partner with him on this course. It's all his material. All I really did was provide the guidance on how to design the course so it's an effective format. So this course, which you can go to www.insurancefreemedicalpractice.com or check the show notes below, comes with 35 AMA PRA CME credits that you unlock as you learn. So that by itself is worth thousands of dollars. Plus, Dr. Paul put together a private group where you can be in it for free. And that way you can interact with other peers trying to set up their practice this way, ask Dr. Paul questions and more. The course is only $3,200. Really a drop in the bucket considering the fact that it's going to change your life and help you live a life of autonomy, of freedom, and profits with an insurance-free medical practice. So check the show notes below. Go and click the link. And if you want to learn more, if you want to just watch a webinar to learn more about Dr. Paul, click the link in the show notes below or go to easyorthopedics.com/consulting. And there is a webinar that he and I did on the 3 secrets to launching an insurance-free medical practice. And I think you'll enjoy it. So with that being said, let's get on to our episode with the godfather of ortho, the one and only Dr. Ira Kirschenbaum. Enjoy. Welcome back to the show, everybody. And as a reminder, if you're a clinician, don't forget that you can unlock your AMA PRA Category 1 CME credit for this episode. Just click the show notes below. And we're joined by a good friend, a fantastic guest. You know him as the godfather of ortho. Many of you know him as Ira Kirschenbaum. Dr. Kirschenbaum, thank you so much for joining the show today. How are you doing?
I'm doing fine. And now I'm doing better talking to you.
You know how to make my day, sir. You know how to make my day. It's good to see you. I miss you. I know we talked about it. I had serious FOMO about missing the Ortho Summit. Before we kind of get into the topic today, how did you like the Ortho Summit?
Well, first of all, a plug for Ortho Summit, of which I am not any founder. I'm not on the executive board. I'm just on faculty. I think Kevin Plancher has hit a home run with this course. I think without this course, we would lose a tremendous opportunity for collaboration, education, and change. This course is a change agent. I mean, he keeps it fresh every year, something new, something like this year, for example, there was the Young Physicians Leadership Forum. If you were between 2 and 10 years out, you actually got free registration, the first 100 people, to go to the course. And there was a whole 2 half days with senior faculty dedicated for topics, clinical and business, for that group. And that was a new idea that Kevin came up with. Has a great team, and it's a great place for industry to go. It's a place where it's called Orthopedic Summit Evolving Technologies, and it's a place where innovation lives in the context of high-level academics. So that's
fantastic. Fantastic.
And this past meeting, it was in Boston. Next year, he says he's going back to Las Vegas. That's what the betting line in Las Vegas says, that he's going back to Vegas. Place unknown in Vegas, but it was 2 years in Boston, which were great. It sort of gave a little different flavor to the course, but we're excited. I'm excited to go back to Vegas. I play craps and I always win heavy. Everyone always wins when they go to Vegas. I think so. That's true. I think
that's what I hear.
I think I have built the Bellagio 3 times myself to what I've lost in craps there. But it's a fun place.
It is absolutely a fun place. And yeah, I think Dr. Plancher has done a fantastic job with it. And I gotta, I really admire what's going on in the ortho world. I'm kind of spreading it to other specialties. I was talking to somebody from the neurovascular world. I'm like, you got to see what they're doing in ortho. You have JOIE, which we're going to talk about, which is really democratizing publishing and digital publications. Then you have the Ortho Summit, which is doing a great job with redefining in-person events. So I really love what's going on in the orthopedic world. So let's talk about the topic today, which is, for the first time in history, there is a way where everyone, both surgeons and industry, can publish and develop thought leadership through digital publishing. Kind of, talk us through the history of that. I mean, you're somebody who's very, who's got a lot of history in the traditional publishing world, and then you decided to kick it right in the groin and come out with JOIE, which is really, let's face it. It is a swift growing kick to the traditional publishing world, and we love it. It's been needed, but kind of walk us through that and like, where is it today?
Well, let me start off by denying that the reason I did this was to give a swift kick to anybody.
It was a byproduct of it, maybe.
Yes, it turned out to be an unintended consequence of downstream effect. I was feeling, and I gave a lecture at ISTA, International Society for Technology and Arthroplasty. It was in New York this year, so of course I was able to get my immigration visa from the Bronx to go into Manhattan. I think
very important for that. I heard that immigration visa out of the Bronx is difficult to get. Glad you got it.
It's a problem, and we're worried about Border Patrol and everything, but it worked out okay. So. I gave a talk on, I was asked to give a talk on JOIE and innovation in publishing. And so on stage were a number of other people who did innovation, which was very interesting. Someone who was a serial entrepreneur in robotics and had a number of things. Someone did ceramic innovations, did that. Someone did ultraviolet radiation for sterilization innovation. I decided to do something simpler. I decided to take on a 7th century industry that hasn't changed and is owned by 4 major companies in the world. And I figured that was the easiest thing to do. I mean, it was the low hanging fruit. We're really not taking on anybody. We're actually just created a new disruptive product. We didn't try to do change. We didn't try to do change for the sake of change. We did something for the sake of how we felt publishing should be, and it turned out to be almost a radical shift in change. For example, there's over 300 journals in orthopedic, and now what is extremely popular is open access journals, of which most of them are still completely owned by the 4 major publishers, who, by the way, nothing but deep respect for, high academic standards on average, and they do publish some of the great journals in the world. But this open access environment, I had to pause because I had other choice words for it, is not very conducive to for publishing for the rest of us in the world. For example, a couple of journals in orthopedics charge as much as $4,000 to authors to get their article published in the open access journal. And so they're publishing the same amount in the print journal, and the open access, which supposedly has the same standards, they're actually charging the authors a tremendous amount of money. Plus, there has been, in my opinion, online publishing should have decreased the cost of everything to everybody. I mean, it is absolutely much cheaper to publish online and keep it open access. I don't know where all this comes from. One of the major publishers had $1.4 billion in gross revenue last year. I think that charging the authors may be a little over the top. I don't run their books, so I don't really know. But even that wasn't the reason that JOIE came about. We didn't do this to do open access. Open access was the how we were going to do the why we did JOIE. So the why we did JOIE was that around 2009, I had an idea. I called it the Journal of Experience because I was beginning to notice an influx of claims data database studies, which are the experience of nobody. They are literally it's information anonymized from claims databases, and the source of that information has a lot to do with coders and how people code. You often can't compare the severity of comorbidities. And I remember, two of my great mentors, one I trained with, one I worked with, one was Dick Rothman, and one was Chitranjan Ranawat. And both of them had many articles in their life. And I will remember many of them. One would be sort of example, Dr. Ranawat would say, my experience with my first 200, this type of knee. And he would discuss the clinical results and the value of using that implant. That article wouldn't even get remotely accepted today, despite the fact it offers great value because it's the experience of Chitranjan Ranawat. I mean, that is an amazing experience. And that article just doesn't get published now. So it became a Journal of Experience. And the why was to bring back two things: experience and the ability to write about early innovation. That was our why. Okay. And that's originally, I had the title of the journal was Acta Experiencia, which is kind of named after Acta Scandinavia, and we went to the Ortho Founders Group, which is a group of orthopedic surgeons who used to get together periodically to discuss innovation. And everyone universally thought Acta Experiencia was possibly the worst name they ever heard. So it made me sort of change. And we worked on a name, and I said, well, it's about experience innovation. So someone said, why don't we just call it the Journal of Experience Innovation? And then Jan Koenig from NYU Long Island nicknamed it JOIE, almost at the same time, but a little bit afterwards. Vindasa nicknamed it JOIE independently. So I give them both credit for calling it JOIE. So we had our why, and we spent the first 2 years, we were privately funded by myself. So we were not answering to anybody, to a group of people who would tell us left or right. I chose I was able and had the ability, through the help of both Laura Wynn, who's a lot of people know in the industry, and Beth Best, a lot of people know her as well, to populate our scientific advisory council, our editorial board. We have 30 people who are who's who on our scientific advisory council, and we have almost 120 editors. And we get 5 reviewers per article, and we started publishing. And we started publishing on March 14th, 2020, the first day of the COVID shutdown. We planned that. A lot of people don't know that the journal comes out of Wuhan, and we put the virus out there so everyone would be at home. And no,
This is why I love having you on, Ira.
It just turns out everybody was home and they were looking online, and we were there all of a sudden, like we were there forever. And to fast forward, we now see 14 to 15,000 page views a month and 8,000 unique visitors, which is really mind-boggling to me that we were able to see that growth in 3 years. So, what was missing in the previous industry, or what we found, and this goes into the how we did it. So we had the idea of why we exist, but how we did it, we said, well, first of all, we want to tell our reviewers that we really want to focus on surgeon experience and early innovation. And if it doesn't do those things, it's a negative when you review it. And I hope that makes sense to people who listen to that, So if you're going to give us a claims data study of looking at the Pearl driver database to decide whether this non-steroidal is 1.2% better than another non-steroidal drug, that's neither experience nor innovation. And we frequently have desk rejected articles like that. The other thing is we wanted to make sure the articles reach the rank and file who do 80% of the orthopedics in this country. As Craig McAllister, a friend of mine and the owner of the company SwiftPath, said, looks like you're building a journal called the Journal for the Rest of Us, and that's one word, rest of us. Plus, we said industry had to have a voice. So we did not mind if someone had an early innovation with a new product that clearly benefited industry. It didn't matter. Every product we put in, every drug we put in comes from industry.
Why is that, by the way? And if you kind of dive into that, because that's kind of rare to hear that, a surgeon or surgeons are open to saying that like industry should have a voice. Usually it's the opposite. So why was that important for you guys?
Well, it was important because it's the reality of early innovation. What do I mean by that? And if we're going to publish early innovation, we needed people to know that if you started your own, if you had an idea and you patented it and then you sold it to, let's say, company X, Nuco Ortho company, we're okay with that having everyone knowing that Nuco X makes it. These are not white papers we're publishing. They are articles with critical analysis of the product or a positive analysis of the product. But where else are orthopedic surgeons, rank and file, going to learn about someone's early experience with a product that is peer reviewed? In the past, you'd have to go on LinkedIn and someone would say, I used Nuco X and with 5 cases and it worked well. Oh, I used it too. I didn't use it. And then there's a sort of a LinkedIn exchange. We essentially apply peer review to the idea of early innovation, knowing that it's early innovation, and everyone goes in eyes wide open. There's no question. We're completely transparent. We're not pay for play. We don't give any benefit to people who advertise. Everything goes through a very strict peer review process. To give you an idea, we have 5 reviewers of every article. 5 reviewers, which is one of the reasons that kind of interesting. We also pay our reviewers. We pay them an honorarium. It has gone up over the last 3 years. We pay them an honorarium to do the review, just to finish the review, and in a certain time frame. And we don't play the game other journals do. Oh, this will look good on your resume. You know what looks good on your resume? $100 Amazon gift certificate for doing a review. It's not huge what we're doing, but it's a way of saying thank you. You spent some time, and we share in the journey that is JOIE. We even one of our products are these journal clubs or topic clubs. Next year, we're going to be coming out with what we call super sessions. We're changing all the journal and topic clubs to super sessions, so they'll be really on topics, but loosely related possibly to some articles on the journal. And those, we actually pay the key opinion leaders an honoraria to show up from us, because we value their time and we value their effort. And we don't make an assumption that just because they get this great exposure that they owe it to us for free. So by the concept of democratizing is, JOIE wants to just be in the black at the end of the year. And our partners are KOLs who write the articles, or, people don't get paid to write the articles, but if they do a journal club or a super session, as we're calling them, unless you have a better word, we thought of calling it the JOIE zone, like the red zone. But, we think they should be paid for their time, We've had some articles, as you know, that have gone over 12,000 views and 500 downloads. And that's just huge volume. About 45 to 50% of our articles have gone over 1,200 views. And I think that's a testament to people's interest in what we're doing. And no article just lives in an issue. When we publish every month, we try to publish every Sunday and Thursday a new article. So we're on a schedule. But 2 months later, we'll bring back on LinkedIn. And that's the other thing. We're connected a lot to social media, specifically LinkedIn. I think LinkedIn feels like a safe space for orthopedic surgeons. and for medical people to discuss some cases and to have intelligent discussions. We don't have any comments on Joey. You cannot leave a comment on the article on our page. We encourage people to comment on LinkedIn.
I think that's a smart approach as well, because, you know, there's going to be higher volume on LinkedIn. It gives more exposure for the journal. But I think more importantly is that, like, Joey wants to focus on what Joey does best, which is like publishing, and not like competing with a multi-billion-dollar conglomerate, because, you know, LinkedIn is owned by Microsoft. But I think what's interesting about it is that Joey is serving as a catalyst to allow surgeons to make the most out of LinkedIn, which is this idea of real-time insights from experience and innovation, where normally in the past, and I think this is like a Gutenberg revolution on steroids, in the sense that, you know, in the past, if you're a surgeon, you might go to the annual conference once a year, learn some things, go back to your practice and change. And so, like, your technique for a certain approach might evolve every year and a half, maybe 2 years.
Yeah.
Versus with Joey, these techniques and approaches are literally evolving on a weekly basis, because you can publish via Joey, have a discussion on LinkedIn, get some of the, you know, top surgeons in the world, both academic and private, to comment, provide feedback.
Right.
You see that feedback and say, "Oh, I never thought of doing it this approach or that approach." I mean, and what's fascinating is like the rate of innovation of adoption. So, for example, I don't know if anything's been published yet, but it probably will. But like, who was it? Think Surgical has their mini robotic drill, right?
Right.
I don't know if they've published on Joey yet, but I've seen like Matt Barber and some other people post about it.
I'm just waiting for them to publish. Yep.
Don't worry. Well, their CEO's coming on my show tomorrow, so I'll be sure to mention and be like, "Hey, how come you guys haven't been on Joey yet?" You know?
Yeah, Stuart knows that. Stuart Simpson knows that. Yeah.
He's a good man. I like the way he does things. But yeah, I think that's the exciting thing. And I think the other side of it is that it's kind of bridging this gap between industry and clinicians in a way that hasn't been done. Because usually a lot of innovation in the past, if it wasn't a startup, it's usually the big conglomerates, Stryker, Zimmer, etc., sort of having these innovative discussions with the chair of, I don't know, you know, the Hospital for Special Surgeons. Oh, sorry, that was a misnomer. The Hospital for Special Surgery. A little slip there. But again, like, it's broadening this discussion of innovation, and I think that's what's going to make it more interesting. Is that it's like biology. It's like survival of the fittest. So it brings more ideas to the table in a much more public forum.
Well, what we're also really trying to do, which is very important, is we don't want to poke any bears. We are happy that Journal X and Journal Y exists and do it their way. Everyone has a role. You know, there's space for everyone at the table. Okay, a lot of the big publishing companies don't want you to think that, but there's space at everyone at the table. One of the interesting. I'll just tell you an interesting. What I think is an interesting sequence of events, a story about something about Joey, was that over the course of 2 years, we published 3 articles on innovation on biologic augmentation of tendon tears, rotator cuff tears, or Achilles tendon. There's a growing world of biologic augmentation. Okay. Now, what's interesting about that is that the first article was Sean McMillan, who is very prolific out of Virtua Health in New Jersey, and talk about having trouble getting an immigration pass to get out of his state. You know, try New Jersey. Sorry, Sean. I just want to take a dig at New Jersey, even though my daughter lives there. I will say they had 5 cases of their BioRes implant, and they did great. And it was buyer beware. This is what we do. This is why we did it. This is what we found in 6-month follow-up. We rescoped them. It was a great IRB study. And then about 8 months later came an article from a company called Embody, their product called Tapestry. Similar type of innovation, but a little different product, but in the same space. And then about 8 months after that came a product from a company called Atrion, a similar biologic. So essentially now we have three major early innovation articles in a single space in orthopedics. In the past, imagine trying to find information, like you go and visit Bob Jones at Columbia University. There is no Bob Jones. That's why I said that. You go visit Bob Jones at Columbia University, who is using one of these products. And so you try it and you put it in. You don't even know the other two exist. Now you know they exist. So if you want to, you can get on a plane or bus or car, train, plane or bus, or if you're John Candy, automobile, and you could go out to Sean McMillan and see the Biores, or you go to Brian Badman to see the Atrion, or you go to Meet Nathaniel to see because now you know they exist. They're
Yeah.
been
And
published.
I'll give a shout out. What's even better today, about I think it's an exciting time to be in our industry is that with companies like Daniel Hawkins, Avail Med Systems, you can essentially virtually join those cases live from the comfort of your home or in between cases and see what's going on. For me in the State of MedTech, we talked about this, and I you're definitely a mentor and advisor for me. And so the idea that to do more live streams where physicians talk about cases and products they like, I just think it's like, medicine it's not like medicine when my father's in practice, right? And it's more difficult, but I think finding ways to make it exciting, right?
Yes.
And engaging and easier, right? Because when you go to an event like the one that Joey held at AAOS or an Ortho Summit and everything, you leave so energized. But the problem is, you shouldn't have to wait like once a year to go do that. You should find ways to engage digitally and grow with your peers, right? And I think that's what Joey's doing. And I think especially the ortho community on LinkedIn is just amazing.
It's phenomenal. And we a plug for another course, just because we were at this course and I was really impressed with the energy and innovation with Shoulder 360.
Oh yeah, I heard about that's another one I heard was really, really done. Who runs Shoulder 360?
Joe Aboud, Rafi Mirzayan, and Paul Sethi are the major chairman of it. Anand Murthy's involved. Kevin Farmer, I saw down there. Sharif Bichet was there. Kevin Bonner was there. It was a who's who of shoulder, but what was more important was the way they ran it. It was everything cutting edge, everything, and a lot of rubbing elbows, a lot of people communicating, and they extended it a bit to social media where they have a LinkedIn presence. Really, it almost gave me respect for shoulder surgery as a joint surgeon. I tell Joe I
Shots fired.
Yeah, I told Joe in the past I had the minimum respect for shoulder surgery. Now I have moderate. No. It was. It might have been. I mean, it was on par with Ortho Summit in a sense of for shoulders. Ortho Summit course is so comprehensive; it's a different type of course. But if you were interested in shoulders, which is I think the fastest growing field of innovation in orthopedics is shoulders, no question. Second would be foot and ankle, but I would certainly say that shoulders. I mean, joint replacement's a big area, but there's not a lot of crazy innovation going on there. When they say, "Oh, we have cementless knee replacements," well, we had cementless knee replacements 35 years ago. Now they're just a little better. It's not innovation. Robotics, well, it's old news now. Robotics in knee and hip replacement. Shoulders really just a place where everything from what's the best reverse shoulder to do you use biologic augmentation, how you do anterior stabilization of the shoulder. We had a session, a Joey session on innovation in shoulder, and we had a who's who on this. Almost all the Shoulder 360 and Patrick Denard, who runs Pinnacle Shoulder Meeting was on it. These guys were going at it
Really?
online, and they loved it. They loved it. Nobody was disrespectful, but they were on the edge of their seats of wanting to be the next one to speak. And since we run the Joey Super Sessions, next year it's going to be almost every Wednesday.
And
No,
you were doing them. I attended a couple of them this year. I think I did. The one I recall was the one on the BioBrace one, which was really cool.
yeah,
And
that was
and by the way, I gotta give you credit. Like these are really well attended. Like the one that I got on, like it was Wednesday, honestly 4 or 5 Pacific, but there was like 80 people on it.
yeah.
It's a
And
lot of
we have about double that in registration, and about 80 people show up. It's almost exactly 50%. I don't know.
Those are really impressive numbers. Those are really impressive. I'm wondering, what's your advice? Like, if you can give kind of like some steps, like, because a lot of the younger orthopedic surgeons, I think this is a really great way for them to start developing what do they want to be known for, and what do they want to be a digital opinion leader on.
Yeah.
What's your advice to them?
Number one, you need to hone your craft. You need to be. There's a scene in Live Free and Die Hard, one of the Die Hard movies, where Justin Long looks to Bruce Willis when he just did some crazy thing, and he said, "How do you do that?" He said, "Because I'm that guy." How do you become that guy? Well, it's a long story. It was a great line, and it was like, you want to be that person, that guy, gal, whatever. You want to hone your craft where you are the shoulder surgeon, the knee surgeon, the best you can be. Because in the end, if you're really good at your craft, it really helps to work with industry on innovation, to take your idea to the next level, to have friends who are similar to you. So first of all, to be a digital opinion leader, you got to be a key opinion leader. And you can't just be somebody who has a lot of followers and yaps a lot. I mean, I'll give you a great example. Scott Sigmund, who is a huge presence and a digital opinion leader, is a tremendous KOL. We're talking about a top-level, national-level surgeon who has got very involved in digital. Okay, so I think first of all you have to have hone your craft. The second thing is you have to be willing to jump into the water 2 feet in. You can't sit there and say, "I'm going to lurk around and just comment on someone else's posts." You have to have a story. Yeah, you have to tell your story. If you're just commenting on, I would definitely do it that way. Look at Matt Barber, who has this amazing post where he has this black and white dark room, and he walks in, sits in a chair, and waxes elegant with his deep Southern drawl, and just a brilliant influence on people. So you need to define yourself, define who you're going to be. And then you need to spend some time doing it. This is not for the people who say, "I'll do it when I get a chance." You almost have to schedule yourself. Think of it like working out or weightlifting. Better. You don't weightlift every day. Maybe you weightlift 3 times a week, but you don't weightlift when you remember to weightlift. And there's some heavy lifting in being a DOL. And I think that phrase, the first time I saw that was when Alok Sharon wrote an article on
That's right.
leaders and digital opinion leaders.
And that was on Joey.
Yeah, and that was on Joey. It's a very popular article. And I think Alok hit the nail on the head on that. And I encourage people to read that article. Just go to Joey and type in Alok, Alok, or you can put in DOL and you'll find the article. But I think the other advantage to being digital is an international audience as well. People you would not have access to in Greece, in France, in India, in China, in Korea, just South America. Just huge amount of orthopedics being done in the world. And it's very humbling when you see your colleagues in other countries do cases that chill your spine in complexity. And it brings the world of orthopedics, which seems so large to us, all together that much more online. Because if you go to an international meeting, it's only the people who could afford to go or afford the time to go. But if you have somebody, there are quite a lot of people, I don't want to mention everyone's names, but in the United States, you have someone like Herrick Siegel who posts these disaster cases, and everyone in the world comments on it, from South America to Europe to Far East, Mid East, everywhere. And it's a great method of leveling the bar for everybody, and makes you think more because you're reading other people's opinion. You're going like for example, Moby Parsons is in private practice, I believe, in Maine.
Yes, I believe. Yes.
Yeah. And great thinker, great surgeon. Um, he, in fact, his LinkedIn moniker is, "I take large hunks of metal and put them in people to make them feel better."
It's like one of my favorite taglines on LinkedIn. Yeah.
Yeah. But Moby has rock star opinions clinically. And so just like Joey's a journal of experience, LinkedIn is the comment place of experience. You don't get people sitting on LinkedIn, well, there was a study last year that showed this. And no, they say, this is my opinion. It's just without social media, Joey would not be what Joey is. And without Joey, maybe social media wouldn't have a journal for it.
Right. Right. Do you, for surgeons who are trying to find that niche, what's the best way of going about it? Like, do you suggest that they maybe spend time going through the orthopedic community and JOIE community on LinkedIn and, first like commenting on things before they, to figure out like what they should publish about? Because I think that's one of the things that a lot of people struggle with is like, what's my thing?
Right. And I think once you get, if you're an innovative person, not everybody is, things come to you when you get involved. I was when I was at International Society for Technology and Arthroplasty, people asked me, how did you come up with that idea or this idea? I said, I didn't. These were barriers that were in front of me and I needed to solve. And I am so annoyed at barriers to do something well that I will create something. If it's not, I will look for something first to see if somebody has gotten through this barrier. And if not, I'll think of a way to get through the barrier, and if I look back at my career of various inventions and projects and websites I've started or helped start, they all have the same thing in common. I felt there was some kind of barrier or something missing. And I think that's a great place to start. If you're in the opera, my very first entry into innovation was through a company called InnoMed, INNOMED. InnoMed is owned by Jim Anderson. They're out in Savannah, Georgia now. They used to be in somewhere in Indiana near Warsaw. And if you have an idea for an instrument, even a retractor, a piece of metal that's bent a certain way, and he likes it, he'll make it and put it in his catalog. So I developed the Kirschenbaum foot positioner, which to this day is one of his largest selling products. And I make 7%. Why? Because I was having a hassle with positioning the foot in knee replacement. So I came up with an idea. That was 1990. Now I did some other innovation before that digitally, as you know, but that was my first metal,
That company's still in that company's still around, InnoMed?
Oh yeah, I get quarterly royalties on the Kirschenbaum foot positioner.
That's amazing.
I go to Vegas and go to the craps tables. It's all on InnoMed.
I am looking this up right now.
InnoMed.net.
There, you know what? There it is. The Kirschenbaum foot positioner. This is amazing.
And he insists on, Jim Anderson's a wonderful guy, and Missy and all the people who work there are just unbelievable. And he insists that every product has a surgeon's name on it, unless they created it. You know what I mean? Which they create some of their own. But if you look on site, every product has a surgeon's name in front of it. So that's a great place to start. you don't have to start a company. Sometimes you can just work with a company with an idea. But if you do, if you're dealing with bigger companies, have a rock solid NDA, and if that doesn't work, let them know some people in the South Bronx who could make their life miserable if they take your idea. Yeah, you need some leverage.
Leverage is always very important. You
Yeah,
gotta
you need some leverage with the bigger companies, and they're not in the business of stealing your idea. Bigger companies, if anything, they're going to be the first ones to recommend and insist on an NDA. So in a lot of ways, the big companies are the safest to share your innovation with because they don't want word on the street that they stole Omar's idea.
right.
You
Right,
know,
right.
what are the mid-level small startups that'll listen to you and go, "Ooh, good idea."
That's a good point. That's a good point.
Yeah.
So just in kind of wrapping up, like I'm wondering what are some of the big things that Joey has coming up, and more important, like how can surgeons start like getting involved?
Yeah. So the big thing we're redoing the journal clubs. I think I said, and we're not abolishing them. We're calling all the Wednesday night sessions super sessions because while some of them may be based on a journal club, they're all going to be based on topics. Okay, so it'll be biological augmentation in shoulder. Um, MIS techniques in foot surgery, current trauma principles in the multi-trauma patient, and we get our ideas from articles. Well, so that's going to be a big change because now people can say, wow, that's a topic that I am interested in. And I don't have to read an article and I could sort of get on and do that. So that's one big thing. The other big thing is there are a number of steps in applying for PubMed indexing, and we should be applying for PubMed indexing by the end of this year. Now, there's no guarantee we're going to get it, but we've always judged our impact in eyeballs rather than in how many people have cited us but getting a PubMed status is something that is not required, but something that I think is very prestigious and is a feather in our cap. Now one of the problems, of course, is PubMed is not very used to purely online journals and how they work. So some of the rules we had to sort of modify some things on the journal. So the next exciting thing is hopefully by sometime next year, we'll have a ruling from the National Library of Medicine and we'll be PubMed indexed. We are indexed on Google Scholar. And if people want to get involved with Joey, they just have to email me at ira@joey.pub, joei.pub. We have always room for editors. We have always room for residents and fellows. We have 65 people on our resident fellows and medical student advisory council, of which we have 6 seminars a year for each of them. And I'm bringing on a couple of new deputy editors, which is going to be, we'll launch that. I don't want to say who just yet, but who are going to work, not just names, So I'm looking to sort of, I don't want to call it a succession strategy because that implies I'm leaving it, which I'm not. But I want to bring in some new blood into top decision making.
That's good. And it sounds like at least you're scaling up, which is the most important thing, and getting some help because like it's I think you're busy enough, you need. But I think something I had an idea for. I'm wondering what your thoughts are on this. But I think like for surgeons who are listening, especially if you're like fresh out of residency, I think one idea to figure out like what should you publish on Joey is one is go and engage with. Like if you look up hashtag Joey on LinkedIn, you'll see a lot of posts and everything. Go look at the orthopedic community. But I think the other thing is like make some posts about some clinical cases, some real-time innovative experience that you had. Use the Joey hashtag. Do a few of those over a period of month over different cases, and then kind of look and see like what got the most engagement and comments. And that kind of gives you an idea of like, oh, well, this might be a good Joey article, and then go from there. I don't know. What do you think?
Yeah, I think what you're saying to me is feel the pulse of the community and feed into that pulse.
Exactly.
And
So I
that is
think
the classic Joey article or case report. We love innovative case reports, innovative ways to solve things. It doesn't have to be a series of 25 of my first cases of a weird case. And sometimes our case reports, unlike a lot of case reports in journals, are odd, strange cases. But some of our case reports are a novel way to solve an old problem.
see, I like that. Yeah, I like that a lot.
Like this is how I tie this knot, but I found a new way to tie, a novel way to tie this knot. I mean, that's a kind of a simple knot, not such a serious.
I think it makes it a lot because I think when people publish, they're thinking that they have to publish this like, groundbreaking thing.
Yeah.
Yeah, and I think a lot of times it's just providing a different perspective on things. And again, like I think that's a good framework, which is finding a new way to solve an old problem.
Yes. And I think that's one of the things we're all about. I mean, as people know, we're truly open access. There's no article processing costs, so there's
every week I go and read different things on JOIE. It's been fantastic, and again, it's all free. It's a journal for the rest of us, as you say.
Yeah, thank you.
Absolutely. So, Ira, before in wrapping up, where can people find you?
On LinkedIn is always the best place. You just search my name. I don't believe there's a lot of Ira Kirschenbaums out there.
I just tell people just search Ira K and he'll come up right away.
He'll come up and connect with me. If you're any part of the orthopedic industry, the only people I don't connect with are people who want to sell me yet another financial package and financial advisor.
And those financial advisors are the worst. There's a couple that are going through my course that want to be very focused on medtech. And the first thing I told them was like, look, put out valuable content and get people to trust you before you send a message. Because like these financial advisors are like out of control.
Yeah. So I'm constantly getting, you can double your wealth.
Or like young, attractive girls from third world countries trying to sell you manufacturing solutions.
Yes. And
they all look the same, by the way.
They all look the same. And despite it being sort of like the first time I saw this, I went, okay, that is a new one. That's a new way. And the funny thing is, when you look at something like that, you see who are your connections signed up because you share connections with.
Oh, that's a great point.
And I always direct message my friends who signed up. You signed up to Chao Wan Ching from South China Fashion Company. What are you, a fool? Yeah.
They seem like a nice humble girl just trying to I'm like, no. What if somewhere in the world that some of them are real and they're all just like man, like why is it like nobody accepts our friend request
for the rest of them? Yeah.
Oh man. Well, Ira, thank you so much for coming on the show. For those who are listening, check actually, and we didn't plug JOIE. JOIE has a very simple URL. What's the JOIE URL?
JOEI.pub.
That's it, joey.pub. So make sure to go check it out. Follow Ira. Be sure to subscribe. Also, go look up the hashtag JOIE on LinkedIn and click follow so you can start seeing that content. It's been another episode of the State of MedTech. If you're a clinician, don't forget, unlock your AMA PRE Category 1 CME credit down below, which, by the way, JOIE also is offering CME credits now, correct?
Yep, we
For
are.
everything. Free CME credits. There you go.
On anything you read.
Perfect. All right. We'll see you all later. This has been another episode of the State of MedTech, and I'm your host, Omar Khateeb. We'll see you all next time. Bye for now. Thank you for enjoying another epic episode of the State of MedTech. If you're feeling inspired and love this episode, do us a favor, hit that subscribe button and turn notifications on so you never miss an episode. And be sure to give us 5 stars and write a short review because that helps more people discover this amazing community of ours. If you're a company who has a executive that you'd like to be on the show, or perhaps you want to sponsor one of the episodes, shoot us an email at hello@khateebandco.com. Take care, and we'll see you next time.